Hi, Catie. Hi.
So excited to see you.
So excited.
We're going to be talking about chronic care, so come with us.
Let's go.
Okay, so here is our first question for Irina. So Irina, if I'm a nurse, let's say I'm a nurse, well I am a nurse, but and I'm not sure what I want to do, why would chronic care management be the right thing for me to try?
Catie, that's an excellent question. Nurses are burned out. We all did 12-hour shifts, taking care of numerous patients who are very complex. And now is the time to really focus on yourself and do something that you love to do, which is beautiful nursing, connecting with people. But nurses now can do it from the comfort of their own home, taking care of patients telephonically, and making sure that they don't get admitted or readmitted to the hospital where we all did our 12-hour shifts. Chronic care management is a fantastic way to make six-figure income. With 400 patients on your caseload, the billable time is about $400,000. So do the math and figure out what's better, working 12-hour shifts in the hospital or doing what you love to do from home, just literally using your computer. You don't even need a phone because we all call from our computers now.
And Irina, I mean, what is chronic care management? So I'm sitting here thinking, I wanted to get a job outside of the hospital system and, it's not really working for me, but I don't really know what this chronic care management thing is. I'm not a chronic care management nurse, whatever that means. How do I even get involved in something like this?
Another excellent question. So chronic care management was really designed by Medicare a few years ago when physicians and nurse practitioners said, we are not getting paid for time that we spent on the phone outside of the office visit. So Medicare said, okay, well, we're gonna implement few new CPT codes. We're gonna call it chronic care management, and you can bill us for everything you do in between your office visits. So truly it's the program that Medicare has designed and is reimbursing physicians and nurse practitioners for. So as a nurse, you would have to find a doctor or nurse practitioner with their own patient population, with a panel, and help them manage the patients. And then that physician will bill for the work that you are doing and will pay you for give you a portion from all the stuff that you do. But basically, in order for a patient to qualify, they have to have Medicare and they have to have 2 or more chronic conditions. When you think about Medicare population, about 70% of people have 2 or more chronic conditions, and they all have Medicare after they're 65. So in reality, it's pretty much everybody that has Medicare can qualify for it. In terms of provider, doctor has to have a few different things like, EHR and provide 24/7 care, which they already do, and then doctor can participate. So it's really easy, and it's not, let's say, a program where, we had nurses who have never worked in maybe chronic care, like they worked in the OR or they worked in ER, really acute care. It's not anything that we as nurses don't know what to do. It's really calling patients, connecting with them, and really understanding what their barriers are. And it's not about teaching somebody maybe about diabetes, because we all know that patients know, they've been taught 100 times what to do, what not to eat, and what medication to take. But it's maybe finding out, do they have a transportation to go see their doctor? Do they have money to pay for their insulin? And if they don't, maybe they need something cheaper. So this is really kind of what chronic care management is. And it's every activity. This is first time, Catie, in my career that we as nurses can bill for every minute that was spent with patients. Whereas before, you do something with the patient and then you have to take your time and document it. And then you might need to make another phone call. And people always feel like they're overworked and underpaid. But this is where literally every minute that you do is billable.
Okay, so that sounds awesome and everything, but what if I'm a student nurse? Is this something that you think student nurses could do, or if I'm an LPN, or what if I'm a medical assistant, or maybe I'm not even in healthcare, or maybe I'm a healthcare administrator? Is that something that anybody can do this program?
So absolutely yes, because Medicare basically said that there are codes that only providers, meaning doctors or nurse practitioners, can bill, or there are codes where their clinical staff can bill. And clinical staff is basically anybody that is able to do the job as per policy and procedure or per their certification and license. So if you're an LPN, MA, even if you're an office manager, if you know how to connect with people, and if you have a doctor that's willing to work with you and trust you with their patients, you can do it. I actually have many instances where people contact me, and it could be an office manager who is the wife of a doctor, but she knows patients very well, and the doctor is billing for CCM and she's doing the work, which is absolutely legal, it's ethical. We wouldn't want a maybe high school student doing that because they would know how to help patients. But as long as you have the good heart and you have resources and you understand what it takes to help people, then anybody can do it. And pharmacists, social workers, basically anybody.
So why aren't physicians' offices doing this themselves, or why don't insurance companies do it? And why would they hire me? Because maybe coming out of the bedside nursing, I'm not real confident in my business skills, and I'm would be a little bit nervous about something like this.
Excellent question, for which even Medicare doesn't have the answers. What Medicare is saying is that very few percentage of physicians do chronic care management, and the data that Medicare collected based on patients who were in the program or were billed for CCM was that patient had less admissions, readmissions, patient satisfaction was higher, provider satisfaction was higher, and actually they were able to show $74 per patient per month savings for 18 months of the data that they had. So what did Medicare do, Catie? They are increasing reimbursement for 2022. So as of January 1, 2022, we used to bill, or we still are billing, $994.90, which is still now $42 for 20 minutes. They're increasing it to $64 for the same 20 minutes. So Medicare is encouraging providers to do it. Why don't they do it, Catie? I think because they're already overworked. If you think about a doctor who has a panel of 2,000 or 3,000 patients, they can't physically add CCM to what they do. But in order for them to do it, then they have to hire staff. If they have to hire staff, they have to understand the program very well, train the staff. There's a lot that goes in. And so a lot of them just say, look, it's a great idea, but I just don't know how to implement it. And this is why you can come along and, save them, really, to say, I'm here, I understand this, I know how to do it. Trust me with your patients. I will make sure that your patients are taken care of, and everybody's going to be happy. The doctor's going to get paid, the nurse is going to get paid, patient's going to get much better care.
What if I want to do this part-time? Because I'm not ready to give up my nursing job, and I think that, while this is all exciting and everything, I'm still nervous about, I can't just leave. I got my family, I got my insurance, I've got all these things that I have to do. So is this something that I can kind of do as a side hustle on this, just in my spare time?
So this, I think, is a little bit more complicated than the other questions because everybody have to kind of fill out what their capability and what their level of certainty about your plan for the future. If you need your job, absolutely cannot be without a paycheck, I would say probably don't spend the money on the class because it's very hard to do it. Initially, everything that you'll do, unless you don't have a job, you will have to do part-time, calling doctors, getting to them. This is all, it all can take time, and that could be done while you're working. But once the doctor is gonna trust you with their patients, and the doctor is usually gonna give you a few hundred patients for you to start CCM on, this is a full-time job, and you have to know that you will not get paid right away. You have to do CCM for a month, and then provide billing for the doctor, they bill. So you probably get paid 6 weeks after your initial contact with each patient. But once you start getting paid, those are big checks and they come once a month. So you kind of have to do your own. I never wanted to push somebody and overpromise and underdeliver. But ideally, this is a full-time business that you want to get into. I wouldn't recommend that for part-time.
Okay, so then what does it take to get a contract? Because I'm nervous, as a nurse, I'd be nervous about that too, like the sales and marketing. Like I don't have any business skills, I don't have any sales and marketing. It's intimidating to approach offices and stuff. So how do I even go about doing something like that?
So unfortunately, Catie, what really is, ticking me off is that nurses, for some reason, think a lot of nurses think that they're not good with sales. They are not good at marketing. But I always say, we have to sell ourselves every time we walk into a patient's room. We sell ourselves every time we meet a new doctor, a new pharmacist, a patient family member. They don't know who you are. You need to show them what you can do and what kind of nurse you are. So we always sell. And in terms of kind of, taking that fear and letting that motivate you is where we come with this class, because we'll give you a lot of tools. We'll give you things, let's say, that's called elevator spiel or elevator speech, where, in 3 sentences, you can kind of get a hook to the doctor as to why they want to continue to talking to you. You'll get a one pager. We'll prep you with all your phone calls and scripts. And so, as nurses, we sell ourselves all the time, every day. Every minute we meet a new patient, family member, new doctor, pharmacist. So I want to encourage nurses to stop thinking that we're not good at sales, because we are. And you're not selling anything. You're not selling somebody a pen or a copy machine. You are providing a service that's very much needed. So we help with things like elevator speech, with the one pager, with scripts and talking points. But I want to encourage every nurse to not ever think of you as, I'm not good at sales or I can't do it, but think of you as, I am a fantastic nurse and I can provide this amazing opportunity to the doctor, and just be passionate about what it is that you are providing service on, and forget about that. Don't think about that as a sales and marketing, but we all do it and we can do it anytime.
Okay, and then, the biggest question I have is like, what kind of money can I make with this? Because, nurses get paid, I think, a decent salary. We get paid more than most people coming out of college, and quite frankly, most people in our country. So it's a hard job to leave in a lot of ways, the bedside, because there is decent money coming in. So what am I looking at in terms of this being a better job and how much money I can generate?
So without getting into the math of everything, just remember that every 20 minutes is reimbursed as $42 now, which is going to be $64 for 20 minutes next year. So take $42, multiply by 3, because there are 3 20-minute intervals in an hour, and it comes to about $120 per hour. And this is now. And it's going to be close to $200 per hour in 2022. So just think about how many patients you will have. Each patient is a 20 minutes minimum of time. And as I said, 400 patients, which is a normal, pretty heavy full-time caseload, brings about $500,000.
Irina, that was so amazing. Thank you so much for sharing with us, because I think this can help so many nurses. It can change lives, and quite frankly, it's like the perfect work from home.
Thank you, Catie, for having me, and good luck to every nurse with anything that you want to do. Just remember that you can do whatever you want to do. I just want to make sure that nurses, we should not undersell ourselves.
That